You know what? I've not had direct conversations with the NHL, and I've heard that today too. I haven't heard it for sure, but I understand that there was some questioning. What we provided was our advice and our basically the fact that we would take the health of the players and the health of our province as the primary concern in terms of having the NHL play in Vancouver. I actually think that that is a positive for us, and that it should have been something that the NHL saw as a positive partnership. We are doing very well. We have a good balance, but under no circumstances was I going to compromise in any way the health of people here in British Columbia, and we made that very clear. We also made it very clear that we were absolutely willing to partner with the NHL to make sure the health of the players and the people that were here in British Columbia during the, if Vancouver was a hub city, would be paramount as well. Our advice and our direction was that if there was a positive case that arose, that we would do what we do with all cases that we have here, that we would investigate, and that there needed to be contingency in case there was other people who were identified as ill, and it might mean suspension of part of a series for a period of time until that could be done, that we recognize very much that if there was a large number of people who were testing positive and had illness, that it was likely that some people's health could be at risk, that people might have more severe illness, and that there needed to be contingency built into the plan to make sure we were able to deal with that. So that's the extent of the advice or the interactions that we had around those issues. I think we need to recognize that even though most young, healthy people do very well with this virus, some people do get very ill, and we've seen that in some of the athletes who've tested positive and who've had illness in the last few months. And it can be a very serious illness for some people who may not even recognize that they have underlying conditions that make them more at risk, or for some of the people on the team who may be older as well.
Farhan, do you have a follow-up?
Yeah, just for Minister Dix, is it your understanding that this is now all off the table, or are you expecting any more discussions with either the Canucks themselves or the NHL?
Well, I think this is a decision for the NHL. I mean, I'm very proud of the Canucks. I'm very proud that they made this effort, and I just feel that here in BC, I know that the Premier, I know that Dr. Henry have been supportive of this effort. We've indicated that to the federal government. I just want to make one small point, Farhan, when we go through the list. In Minnesota, they've had this week, not in the past, but this week, on a daily basis, between 242 and 456 cases in this week by day. In Illinois, which is another city on the list, Chicago, 715 cases. In Nevada, they had their highest day on June the 20th. That was 452 cases. In California, they had their highest day on June 23rd. That was 6,712 cases. And none of this is definitive for those jurisdictions. Of course, we're hoping for the best. And in cases of all these jurisdictions, there are people working extraordinarily hard. But we just profoundly believe that the strength of what we've said to everybody is the strength of public health here in BC, that should be a primary concern, and that's our primary concern, and that includes the athletes who come, the players, the coaches who come, the officials who come, and everyone who's taking part in the event. So we think that the efforts we've made in BC to flatten the curve are a strong reason why Vancouver is an excellent site. But we understand that people in the NHL and others have to look at a variety of criteria. But we think that Vancouver has made a strong case, and the foundation of that strong case is the health of the players and the health of the people of BC.
You know, the only thing that I am unflinching and unmoving on is that the primary concern that I have is the health of the population of British Columbia and the health of anybody who's coming into this province. And so the discussions with the NHL were between the Canucks franchise and the NHL. I'm not privy to the details of that.
Do you have a follow-up, Penny?
I do, yeah, and I'm just, I think some people are just a little bit confused as to why our expectations health-wise may be different from other provinces and why that makes them more attractive. And I'm just wondering, is it, debate within the medical community about the best way to move forward? Do you think these are political considerations being made? I think people just want to try to understand why the advice here is different from, say, what it would be in Nevada or Ontario or Alberta.
I don't believe the advice is any different. It is pure speculation that is the reason why the NHL, if they even has ruled out Vancouver. So I think there's a lot out there in the media. I don't know what those discussions were. I've not been told. We all have the very same, at least here in Canada, I know from my colleagues, we have the same approach. I have been very supportive of the NHL approach and the plan that the Canucks put together. I think one of the strengths that we have is the fact that we've worked very closely with a public health focus and with the health of both the population here in BC, but the health of the players and the teams that would be coming as well. So I think it is speculation that is the reason why, if even Vancouver is off the table. I don't know if you want that to
say that the Vancouver Canucks presented their plan. It was reviewed by Dr. Henry and then submitted. The federal government asked for the opinion of the provincial health officer and of the government, and they received it. Obviously, it's up to the NHL to make its own decisions and to decide what's important for the NHL and what isn't from a commercial and health basis. But I just repeat that they may have made a decision, they may not have made a decision, but the evidence is that the focus on public health issues here in British Columbia, led by Dr. Henry, has been exceptional. And I think that's an argument for them to come. And I think they probably received that as an argument to come, but presumably they have many commercial and other reasons that they consider in addition to that. But if I was involved in the NHLPA or I was involved in the NHL, I would see Vancouver as an exceptionally attractive place to come, not because we would bend on health issues, but because we have a strong public health focus here.